Hi everyone, my name is Katie Farron. I currently work as a registered nurse in the med-surg department on a unit that specializes in acute care for the elderly. Today we're going to be talking about interactive patient education planning. The elements of this presentation are going to be a brief introduction, along with three different technology devices that can be used, one being virtual reality, another one being mobile apps, the third being wearable devices, and then we're going to talk about a patient needing interactive patient education, and then a list of all my references. So, interactive patient education. How does technology play a role in all of this? Who does it benefit, and what are three different ways? Patient education is well needed for many different reasons. The main reason being, if they don't understand their diagnosis, then they won't be able to maintain their symptoms. They won't know when to reach out for help or be able to take care of their health. Patients learn different ways, whether it is visual, hands on, auditory, or more of an interactive approach. Interactive patient education, also known as IPE, is important because it is a two-way interactive way for learners to receive the education that they need in order to succeed with their diagnosis. Technology is at the forefront of most everything nowadays, and with Google being at the fingertips of most people, they will look up different ways to help. Patient education helps everyone because the patient receives care that they need. It can help lower health insurance costs and premiums. It can decrease the amount of patients coming to the emergency room when it could have been potentially prevented. Something that we need to ensure that the patients are understanding is the information that they are looking up accurate? Who created this information? Were the people who created the information trying to sell customers or consumers something so that they seem like they need the said item? I'm sure we've all come across this where you are looking something up because you need something, and then you come across some sort of video or influencer that talks about, well, you need to do this in order to do that, and then before you know it, you could potentially be roped into spending money you don't need to spend, or taking something or doing something that you may not even need to do. Along with, how many times do patients come in and say, oh, I looked up, I stubbed my toe, now I'm probably going to lose my toe? No, that's not really what's going to happen. Like, let's break it down, let's see what's going on, start from the beginning and go from there. These are just some of the questions that need to be asked about quick information that patients are finding. It is important that the information that is being found is the most up to date, along with having a backing of it being evidence based. We all know, as we work in healthcare, everything is evidence based practice, and with new tests and studies that go on, updates are done, everybody's re educated on everything, and that's how we roll out our healthcare. The first technology we're going to talk about is virtual reality, also known as VR. VR can be used to help a patient understand a new diagnosis and the physiology behind the diagnosis. Sometimes patients don't understand or get the big picture without some sort of education being completed, like a drawing or a visual. VR can take a person into a human body and help show them. VR can also be used to help a patient learn how to care for themselves, such as changing a trach. To me, teaching a patient about the use of VR and how it can help them is like a show that I grew up watching, The Magic School Bus. A provider can also be in the VR with the patient to help talk them through it, along with everything that they are seeing and ways in which the things that they are doing are wrong or right. In a study that was done by Schultz and their team about how VR can be used to try and decrease the anxiety that patients have about radiation therapy. The study took two different groups, one of which was Group A, where they received the VR simulation prior and after their radiation treatment. Then Group B received the treatment only during their radiation. Both groups stated that they felt that their anxiety was decreased with the VR treatment. Group A, who received more treatments, had a larger decrease in anxiety. Both groups being at least 90% or above of a decrease in anxiety. So the VR went in and showed the patients what they were to be expecting their first visit, along with subsequent visits after that. and possible side effects, and then different ways in which the radiation would be helping eliminate the cancer. And I have a short video showing on how a brief setup of the VR would be done.
Hi, my name is Nicole. I'm the radiation therapist. Come on in. This is our treatment prep area. We're going to be making a mask today in preparation to your simulation. What we're going to be doing, very simple. We're going to have you lie down here. We're going to be making a custom mask. All that consists of is this material, which is a plastic thermal material that we put in hot water in our water bath right here. It makes it like a nice, warm, almost hot washcloth. We place it over your face and it cools quickly and it forms to your face and holds you into the treatment position. During this, we can actually, as you can see by our lasers, mark you in a actual pattern for treatment and line you up daily in a consistent treatment pattern for aligning every single day. All we ask for you is to lie here and we will do all the work. Okay, all I ask is that you have a seat here. We're going to have your knees come over the bolus. The bend of your knees goes right over the bump.
So that would be the potential first step of how a patient would use VR in their treatment. They would watch this video, hopefully help answer any questions that they might have or help decrease some of their anxiety because they know exactly what to anticipate by seeing the inside of the room, seeing the material that's going to be used, along with just kind of wondering and guessing and going down this path of what ifs before their first treatment. Another technology advancement is mobile applications. How can mobile apps improve patient education? Apps like MyChart through the Epic portal, they can help with telehealth, view your results, message providers, along with specific patient education. Mobile apps such as electronic health records can help with patient education and preventative care. The mobile apps can act as an interactive source to help deliver healthcare information in a variety of ways. These ways include, but are not limited to, videos, articles, and infographics. When setting up a mobile app, the preferred language can also be picked to ensure the information being given to the patient is their preferred language. With the information being on an app, it can be downloaded onto a phone, which is easily accessible and compact, so it can be accessed anywhere. With all of the different types of formats for information to be delivered, it helps improve the success for patient education. Some of the apps also allow the patients to be in touch with their providers. If there is a question for a provider, they can simply send a message to them and someone will reach back out from the office. Reminders of appointments also appear on some of the apps. There are notifications that can be sent when a medication is due to be filled, an appointment is coming, or a preventative measure needs to occur for their health, such as a physical. These apps also show lab work or any other testing that has been done for them. When they go to a provider or a hospital, their after visit summary along with notes from the providers are also in their electronic health record. The electronic health record apps also can be used for telehealth appointments for patients who have difficulty getting around. The nice thing about the apps is a lot of this information that is downloaded into their electronic health records can be easily accessible. So if they want to review something repeatedly on their phone, like if they have to do steps on some sort of treatment and maybe they lose the papers that they come home with, because we all know we send patients home with, it seems like stacks of papers. They can simply go to their phone or device, whatever device they're using, and look up the steps for the treatment that they're trying to perform and go step by step, along with any symptoms to watch for or anything like that. And
a new service that makes accessing your health record easier.
About the
MyChart is a secure app you can use on your computer, mobile, or tablet. By logging in, you can stay connected to your healthcare team. With MyChart, Your health record is stored in one easy place. This means you'll never lose important test results or letters. And by telling us what we need to know before your appointment, you'll get more time to talk about the things that matter. Healthcare is a team effort, and with MyChart, we're right by your side, always. Ask us about MyChart today.
And then the third technology advancement that I'm going to talk about is wearable devices. These consist of different smartwatches, health ring trackers, EKG devices that monitor your heart rhythm. So wearable devices are another way in which us as healthcare professionals can implement interactive patient education. These devices provide real-time feedback on their own health data. Wearable devices are a way to not only implement a health plan after a new diagnosis, but also as a preventative measure. The devices are typically linked to an app on your phone or another smart device to help keep track of the data. Having the data can help a patient monitor their symptoms along with any life changes that they are making to improve their health. Some patients may need a visual representation of what they are doing on a daily basis to find out how to make better choices when it comes to their health. Collecting the data can also help when they go to their provider to help them remember everything that they are feeling. A provider can look at the data that they have collected and help to educate them on how to make changes for the better. An example of a wearable device is a smartwatch. So many different smartwatches out there track how many steps you are taking, your heart rate, along with your oxygen percentage. Some devices even have an EKG feature, along with a way to assess the way you are sleeping. Not only are there watches, but there are also rings that can help monitor all this information. The devices have come as far as being able to be worn in the water up to a certain depth. For someone who is trying to track their heart rate for a new diagnosis, this is a way in which they can try and do so. The watches can also track their steps if they have a goal of losing weight or for part of an education plan for a new diagnosis. These devices can help to monitor patients with diabetes, cardiovascular disease, and asthma management. For example, if a patient is recovering from a heart attack related to stress, they would need to be educated on preventative measures that they can change to avoid having another heart attack. One of those ways being to monitor your heart rate with exercise or any movement. Understanding how fast your heart is beating when doing certain activities is important to let a provider know about if it goes outside of a number that they recommend. These wearable devices can monitor sleep. Lack of sleep can greatly affect how your body reacts to situations. A patient can monitor what they do prior to going to sleep along with how they sleep to better improve their outcomes. This is a great example for our patient, Joey Smith. Joey Smith is a 60-year-old male married with 3 adult children. His recent hospitalization is for chest pain. He has a past medical history of high cholesterol and he's up to date on all of his vaccinations. Joey works as a lawyer in a law firm that specializes in car accidents. He understands that his job has high levels of stress. Joey states that he doesn't get much exercise except when his grandchildren come over. Joey states his way of relieving stress is with a beer and watching a Netflix series. What are ways in which we can help Joey? What is Joey's education level? These are a couple steps that we're going to have to ask ourselves before we try to educate Joey. First one being, what is Joey's education level? How much does he understand about cardiovascular disease? Does Joey have any means of monitoring his symptoms at home? How does Joey best learn? And does he need any assistive devices? So upon asking questions to Joey, we find out that he does have a smartwatch. His son gave it to him for Christmas. He has set it up, but he doesn't really understand how it works. He wears the Apple Watch once in a while, doesn't really wear it that often. His son told him to wear it to count his steps and that they could have a competition, but he just couldn't be bothered with it. We understand that Joey has a college level education, but he doesn't know much about healthcare. Along with, if Joey's going to be reading something, he does need reader glasses as an assistive device. He does not need hearing aids, and his primary language is English. So these are all things that we're going to need to understand before we try to even educate a patient on anything, is the basics of basically who, what, where, when, how. How can we educate him? What does he need? All that kind of stuff.
There are a number of new technologies that are being used to monitor heart health. And one of the biggies where we've seen the biggest change over the last several years is the increase in the number and use of wearable or handheld electrocardiograms, or EKGs. And those come in a variety of different flavors. Examples of wearable devices that are used for monitoring the heart include the Fitbit devices, the Google Study Watch, the Apple Watch, and there are several other smaller companies. Patients should always, if they're monitoring themselves for heart rhythm issues, particularly if they have a heart problem, be talking with their physician or their provider about the fact that they're doing that. And also talk about how they want or how they should use the device and transmit information about what they're seeing. There are a number of new technologies.
So this is a quick video that we could show Joey on how his Apple Watch could greatly benefit him, along with finding other videos out there. So, like I stated, we would want to make sure he has his glasses on. We would explain to him all of the symptoms for the chest pain that he came in with. He did not end up having a heart attack. He just came in with stress-induced chest pain, and along with showing him his watch, teaching him about education, teaching him better coping mechanisms on how to relieve some of his stress, monitoring his heart rate on the watch, and ensuring that he's getting up and getting at least a certain amount of steps a day. Because his job is primarily sedentary, we want to make sure that he's getting a certain amount of steps, so he's getting some sort of cardiovascular output exercise done, and have different goals that he can meet with his healthcare provider, along with setting him up with a cardiovascular doctor prior to discharge, or post-discharge, I'm sorry.
And one of the biggies where we've seen the biggest change.
And next are just a couple of different references from videos and information that I found in the presentation. And just a quick thank you for taking your time to watch my video on interactive patient education with the use of technology. Have a good day.